Warning signs: you might have trouble getting pregnant naturally. I'm a fertility doctor. I see couples every day who are trying to get pregnant naturally or who are at some point in their fertility journey or during fertility treatment. To be able to understand what can lead to difficulty in getting pregnant, first we need to understand how a normal natural pregnancy happens. So let me explain that in brief first. To be able to conceive naturally, your ovaries should have a good number and good quality of eggs. For women, as age increases, the egg number decreases, as also the egg quality. The risk of having genetic abnormalities increases with age. So, in addition to having a good egg reserve, you need to have regular menstrual cycles. Having regular menstrual cycles means that you are ovulating regularly every month. The second thing is that your fallopian tubes need to be open and need to be healthy. Your uterus needs to be normal, the lining inside your uterus needs to develop well. Your husband needs to have good sperm count, good sperm motility, and last but not the least, you should be able to have sexual intercourse normally, meaning there should not be any sexual dysfunction. So, this is what is required to be able to conceive naturally. When everything is normal, your chance of conceiving naturally every month when you're young is about 15 to 20%. 15 to 20% means that among young couples, say 10 couples are trying to conceive naturally, and out of those 10, maybe one or two conceive in a given month. So, if all your reports are normal and you're young, you may continue to try naturally for about a year. And within a year, 80% of couples manage conceiving naturally. If you've not been able to conceive in spite of a year of trying and you're under 35, you need to see your fertility doctor. So, what are the warning signs that can help you think that you might not be able to conceive naturally? Like I said, you need to have a good egg reserve and need to have good quality eggs. For women, as age increases, the egg reserve decreases, egg quality decreases, and having genetic abnormalities in the eggs increases. So, if you're older, you need to see your doctor sooner. So, if you're, say, about 35 or 36, but you just recently married, you've not even started trying naturally, but just because you're 35, 36, you may see your fertility doctor, you may get advice regarding evaluation for fertility. Even though you don't start fertility treatments, you need to know where you stand. You need to know if your egg reserve is fine. If your egg reserve is fine, you're recently married, but you're 35, you may try naturally for about 6 months. And if there is no pregnancy, the sooner you initiate fertility treatment, the better. The second, of course, is if your periods are irregular. Irregular period indirectly tells us that you are not ovulating on time. Either you're not ovulating at all or you're not ovulating when you should ovulate. So if your periods are irregular, it can point towards having polycystic ovarian syndrome or maybe thyroid abnormalities or high prolactin levels or sometimes poor ovarian reserve and leading towards perimenopause. So if you have irregular periods, do see your doctor. Like I said, you need to have patent and healthy fallopian tubes. Now, tubal damage or blocked tubes don't show externally. There are no signs or no symptoms. If you are somebody who knows that you have endometriosis or you've had a previous history of appendicitis or appendix surgery or any other surgery on your GI system, if you've had a past history of tuberculosis, if you have had previous pelvic surgery, if you've had previously pelvic inflammatory disease, so these are the conditions or these are the problems which can lead to tubal damage or blocked tubes. And if you have a history of any of these, you should visit your doctor and maybe discuss getting an HSG or even a hysterolaparoscopy if the HSG shows blocked tubes. The third thing I said is that you need to have a normal uterus and you need to have a good uterine lining. Usually, checking the uterus is not something we do right away. But if you are someone who has heavy, painful periods, passing blood clots, or bleeding after intercourse or intermenstrual bleeding, it could point to some abnormalities in the uterine lining or in the uterus, and you need to get that evaluated. If you have very light periods again, it could point towards having a very thin uterine lining, or it could point. In India, tuberculosis is quite common, and tuberculosis can have an impact on the tubal health and also on the endometrial lining. So if you have a history of tuberculosis, do see your doctor. Like I said, having abnormalities in the husband's sperm count and motility can lead to difficulty in conceiving, but there are no signs or symptoms of this. So a semen test is not something which is advised for a couple who has not even been trying for a pregnancy. If you've been trying for quite some time and you've not been able to get pregnant, for evaluation of your husband, the most important test is getting done a semen test. And doing the semen test in a good laboratory, preferably in a IVF associated laboratory, is most important. And the last but not the least, being able to have sexual intercourse. So if you are someone who, if you're a couple in whom there is erectile dysfunction or there is anejaculation or there is pain during intercourse, these are the scenarios which will interfere with you getting pregnant just because you're not able to have regular sexual intercourse.